One of them is over 1,400 years old. The other was invented less than 200 years ago. Which one really cleans better?
Assalamu alaikum. I'm Dr. Sumaira. Welcome to my channel Tib-e-Nabvi and Modern Medicine, where timeless wisdom meets latest research. Today we will compare a Sunnah of our Prophet, peace be upon him, with a product of modern dental science. By the end of this video, you'll understand exactly what science says and what our Prophet, peace be upon him, already taught us. The Prophet, peace be upon him, said about Miswak, hadiths recorded in Sahih Bukhari 887, 89, 890, and in other collections too. Meanwhile, the modern toothbrush, mass-produced with nylon bristles, became the global standard for oral hygiene in the 20th century. So which one wins on plaque control, gum health, and bacteria fighting? Let's look at the actual research. Miswak comes from the Salvadora persica, often called the toothbrush tree, native to the Arabian Peninsula and parts of Africa and Asia. A small twig is cut, the bark peeled back, and the end chewed until it forms soft, brush-like fibers. These natural fibers act exactly like bristles, reaching between teeth and along the gum line. Miswak naturally contains silica, tannins, essential oils, and antibacterial compounds, released continuously as you chew. Researchers have studied over 300 publications on Miswak since the 1970s, an unusually large body of evidence for a natural remedy.
The World Health Organization has recommended Miswak as an effective oral hygiene tool since 1986.
The modern nylon bristle toothbrush was introduced in 1938. It's designed to work together with fluoride toothpaste.
Electric toothbrushes add powered bristle movement, offers consistent brushing strokes.
Dentists worldwide recommend brushing twice daily for 2 minutes using a soft bristled brush at 45-degree angle. However, toothbrush bristles wear out, harbor bacteria over time, and need replacing every 3 months. Globally, billions of plastic toothbrushes are discarded every year, raising growing environmental concerns. Now let's get into the actual clinical evidence, starting with plaque, the sticky film that leads to cavities and gum disease. A landmark study in the Journal of Periodontology followed 600 participants for 12 months, comparing Miswak users to toothbrush users. The Miswak group showed significantly lower plaque index scores after 12 months, despite using no toothpaste at all. Another clinical trial found the Miswak stick provided equal or even greater cleansing of oral tissues compared with a standard toothbrush. A 2021 study from the Armed Forces Institute of Dentistry in Rawalpindi compared 300 subjects using either Miswak or toothbrush. The plaque index scores were nearly identical between both groups. The difference was not statistically significant. In other words, a simple twig from a tree can match or even outperform a manufactured brush with toothpaste. This is remarkable, considering the Miswak requires no factory, no plastic, and no added chemical toothpaste. Let's talk about bacteria, specifically Streptococcus mutans, the main microbe responsible for tooth decay. Miswak's natural compounds interfere with how these bacteria attach to the tooth surface, limiting biofilm formation. Let's look at a study from 2004. A clinical study divided 40 men into Miswak, Miswak extract, toothbrush, and control groups to measure bacterial reduction. Results showed a greater reduction of decay-causing bacteria in the Miswak groups compared to the toothbrush group. Did you know that Miswak is great for your teeth? Chewing Miswak also stimulates saliva flow, which helps balance mouth pH, and this process further protects against cavities. So, we all know that brushing is vital. By contrast, a toothbrush itself can become a bacterial reservoir if not replaced or cleaned regularly.
Because a fresh section of miswak can be cut daily, its cleaning tip is essentially always new. This freshness gives miswak a hygienic advantage that a stored plastic brush simply cannot replicate. But science isn't one-sided. Let's look honestly at where miswak shows some limitations too. A randomized trial at Princess Noor University College of Dentistry compared miswak and toothbrushing over a 2-week period. Now let's discuss the findings of this study. Let's examine the data closely. Interestingly, gingival scores rose in the miswak group while the toothbrush group significant change. This suggests proper technique is essential. You may not see the desired results. Researchers attributed this to overly aggressive, not the plant itself. This means that using the miswak correctly is very important. Always use a gentle upward and downward motion. With proper training and gentle technique, studies show miswak can positively support gum health rather than harm it. Toothbrushes also have a practical edge. Modern angled heads make it easier to reach back molars. So the honest picture is this: technique matters as much as the tool itself, for either option. So what does modern dentistry actually recommend today? Increasingly, to combine both, rather than choosing only one. One trial on orthodontic patients found miswak mouthwash used together with an electric toothbrush reduced plaque significantly more than the toothbrush alone. Another study combining both tools found gingival health and biofilm scores improved significantly, more than using either alone. In fact, a recent continuing education course for dental hygienists now includes miswak within official clinical standards. This tells us something beautiful. A 1,400-year-old Sunnah practice is now entering mainstream clinical dentistry. What our Prophet, peace be upon him, recommended out of revelation and wisdom, modern research is now confirming through data. This is the essence of Tib-e-Nabvi and modern medicine meeting. Not in conflict, but in harmony. Neither tradition nor science needs to be abandoned. Together, they offer the fullest picture of oral health. If you want to try miswak properly, cut a fresh piece from the tip and chew gently until fibers form.
Store your miswak upright in a glass of water and trim a fresh tip every 1 to 2 days.
Brush gently along the gum line and tooth surfaces. Never scrub aggressively, which can injure delicate gum tissue. If you use a toothbrush, replace it every 3 months. And always choose soft bristles to protect your gum.
For best results, many dentists now suggest alternating or combining both: miswak during the day, toothbrush at night. Whichever you choose, consistency and gentle technique matter more than the tool itself. So the verdict? Miswak is not only Sunnah, it's backed by real clinical evidence, standing shoulder to shoulder with modern dentistry. And that's the heart of this channel, showing you how the Sunnah of our Prophet, peace be upon him, aligns beautifully with modern science. I hope you have enjoyed my research. Please like, share, comment, and subscribe my channel. Keep following Sunnah, eat wisely, and stay healthy. Fi aman Allah.